Hello, welcome everybody to Revive Health's Daily Briefing Live for Monday, March 23rd. This is our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators dealing with COVID-19. I am Chris Bevelo, Health Systems Practice Lead at Revive Health and your host for the show. And I'm joined, as always, by Chase Kleckner, Senior Marketing Manager at Revive Health and our show's producer. Hey, Chase.
Hey, Chris.
How are you?
Doing well. Doing well. Excited about having Alan on the show today.
Yes. And we are joined with Alan, though I don't see Alan. I know he's with us.
No,
Alan, there he is. All right.
Yeah, I see you.
Maybe you were there the whole time and I just didn't see you. So Alan, Alan is the Director of Marketing Communications at Salinas Valley Memorial Healthcare System. He has also held senior marketing communication leadership roles at Kaiser Permanente and Providence St. Joseph Health, and is known by many of you out there in our field for his insightful blogging and views on everything we do. And we're very fortunate to have him with us. Alan, thank you for joining us.
Yeah, I'm happy to be here. Thanks for having me.
Absolutely. So, as with each show, we plan on covering the latest news on COVID-19, how it relates to marketing communications, highlight helpful resources, share what we're seeing and hearing, all that stuff. We will also open the floor up to questions. As we move through the show, please use the question queue in Zoom, which is down at the bottom of your window. To line up your questions, you can put that in there anytime, and then we'll stop near the end of the podcast to take as many as we can, and then we keep track and try to respond to those that we couldn't get to in future podcasts. You can also use the chat function to talk to other attendees. We definitely welcome that. But if you do have a question, make sure you put it in the queue. Also notice that we're going to provide relevant links that we reference in the podcast in the chat, so you can access those immediately. And as always, we're going to be posting a recording of the episode at the end of the day, sometime this afternoon. You can visit our website at Think Revive Health for that. I'm going to provide more information in a bit on that. So that's a good setup. A couple of just last minute notes. Remember, we're not experts on COVID-19, which is the disease that is caused by the virus, as I've been taught to say. So not a place for medical or scientific advice, obviously, but we do have opinions on communications, marketing, recommendations for all of you. That's, I think, why you're here. But just remember, every situation is unique. You have to kind of use your own context to take in what we're saying and apply it as best you can. So with that, let's dive in. First of all, as we've been doing every podcast, we start with accounts. We use the Johns Hopkins University tool that they've created. Alan, is that something that you rely on primarily, or do you look at others?
You know, I look at others too. I have seen that. I think I've seen some new tools actually from CDC in the last day or two. They're an improvement on what they were doing before. So that's a good one. Also locally, our county has a site that they've stood up with relevant statistics that are local. So I think a combination of trying to get some national, California-wide, and then county statistics have been helpful. So I look at all those on a daily basis.
Yeah, that's great. And I do the same thing personally. I always look at actually our paper, who keeps a running count, the Minneapolis Star Tribune, just because everybody, of course, wants to know how this is impacting them locally.
That's right.
What we're doing in using these counts at a highest level is just, it helps us all kind of keep everything in context in terms of how we're responding, what we're looking for, what we need to be doing. And so when we look at where things are at today, internationally, we have 360,697 confirmed cases and 15,000.
Chris, are you there? You went out.
Uh-oh.
We lost Chris. So I think he said basically 15,000 was the cases, which was double of what we had. And sorry, I've got two little kids at home today, so don't mind that. But he said 15,000 cases, which is double of what we had on Friday. So Alan, if you want, why don't we, or also there's a national survey that we did that we released on Saturday this past week, and went into some really key findings from a consumer survey report of what consumers are looking for from their hospital and health system. So I'm actually going to put a link into the chat that will give you guys access to that consumer report. And then let's see, there's also a health system marketing webinar hosted by Shushmed, Strategic Healthcare Marketing, that they're hosting this week with Suzanne Hendry, Christian Petker, Ed Rafalski, and then Sarah Vizi. That's going to be coming up that you guys should definitely check out. So now let's get into, Alan, what you had kind of planned for today. Not surprising, and we're seeing kind of like an immediate and an ongoing shift as far as how marketers need to operate from a day-to-day basis. How has that changed your plans for the year? And what does that look like so far?
Yeah, and I'm just going to start out by saying too, as hectic as it's been for anyone in marketing and communications right now in healthcare, we know that the frontline caregivers are really, they're the ones who are untold stress, and so I think that's always helpful for us to keep in context. We're working on pushing out a lot of messaging, we're doing stuff, it's stressful. But I just want to take a minute to thank all those people who are doing that because they're on the front lines. But for us, in terms of our profession, really, I was kind of thinking about it, when we were at Revive's conference a few weeks ago, it was all about growth. What are our sort of strategies to do that? And frankly, that's sort of out the window. I mean, everywhere that's dealing with this in any meaningful way, is not worried about driving new patients into anything right now, I don't think. We're kind of putting things on hold, thinking about we need to see the people who do have emergent health issues, and not just coronavirus, COVID-19, but if you have serious other health problems, you still should probably go and see the doctor in most cases. You should have a dialogue open to see if you need to come in. I know a lot of places have canceled elective surgeries, but some of those things aren't even really necessarily elective. Those might be really important things you need to manage your health. So people need to keep having that dialogue, and I think we need to keep reaching out to people. But the time has changed in terms of, it's not about acquisition right now. It really isn't.
How have you seen, has there been a change from virtual care from where you guys are? Yeah.
Absolutely. So, it's accelerating things I think we're already thinking about, already having some conversations about. But frankly, in some markets or whatever, it just, hey, we've got a lot of business. We got people coming in the door. It would be nice to have some additional features for them, and we're looking at it, but we're building out business cases and we're taking our time. Well, there's no time right now. It's sort of like if we've got an idea or a way we can ease the way for our patients, we're going to do it. And so we're looking at, again, things like telemedicine or screening tools or any of that stuff that we can just throw up immediately. How fast can we get this operationalized where, 6 months ago, it'd be like, this is a nice to have, maybe we should do it. And now it's like, no, people, and especially, where I am right now, we have a whole stay-at-home order for the entire state of California. We put it in place in our local county earlier. People are not even supposed to leave the house. So again, if we could help them, assess some of their symptoms up front and figure out, maybe a telehealth visit is appropriate because they don't need to be coming to the ER. They need to just have a quick triage and kind of set their mind at ease. So I think it's just accelerated things we were already thinking about, the tools we already need to deliver. And now we've got unfortunately, I wish it wasn't a crisis causing it, but it's really making us embrace the opportunity to look at those tools. And I think they'll last beyond this time.
Yeah, I couldn't agree more. Chris, welcome back.
Hi. Wow. The joys of working at home on a Monday. I don't know which right. It's a combination of the two.
Yeah, I know. I had internet issues this morning. It was down for 2 hours. So, but glad to have you back. We're covering just the immediate shift that this is causing from a marketing plan perspective, but also adaptation of virtual health if we haven't had already. And so that's kind of where we're at currently.
Cool. So do you want me to jump in or?
Yeah, feel free to jump in.
Did you cover that totally? Did you cover the resources we were going to walk through, Chase, since now I'm catching up?
Yes, we did cover the resources.
Excellent.
The one we did not cover was the Jared Johnson resource that he mentioned on LinkedIn.
Okay, so I'll just plug that real quick. Jared Johnson, who many of you guys know, has created a LinkedIn group for hospital and health system ARCOM professionals. So it's titled the COVID-19 Marcom Resources and Relief Group. So you can search for that. You can just go to Jared's LinkedIn profile and he's got connections to it. It's a great place to go. A lot of folks are posting in there. There's a lot of resources. I'm sure you covered the strategic healthcare marketing webinar.
Yep.
Others like it. So just want to point that out and appreciate Jared sharing information on this podcast. So
yeah, I'll make sure to put that in the chat as well, a link to that.
okay. So do you guys feel like you covered the shift in what marketers need to do, or do we need to dive deeper? Me coming in the last second.
I think maybe a little bit deeper of something I didn't get to too. It's just, again, in terms of being able to be flexible. So, as I was talking a couple of weeks ago, I was like, hey, make sure you're working your plan, right? Well, again, the plan is sort of out the window. So the flexibility of the messaging and tactics really have to change. And I think, where I looked at when I came into work kind of last week, it was like, oh, we've still got some general health messages going on in the community. We got to stop those, right? I mean, that's just ignoring what's going on. So I feel like if you haven't done that step, if you still got some things on autopilot in terms of what you're messaging your community and you're dealing with this in a big way, like you got to stop that. So I feel like it is time to, if you hadn't already sort of put that sort of like crisis marketing, crisis communication plan in place and really rethought everything you're doing before, you got to do it now.
Yeah. And I think one of the things that we're seeing to that point, Alan, is maybe the number one focus area for our audience needs to be internal communications, because obviously it varies depending on where you're at, the size of the organization, whether you're in Seattle or, podunk rural somewhere where you haven't got any cases, whatever. Our healthcare workers are, in the thick of this crisis. They're on the front lines of this. And we are seeing more and more situations where hospitals and health systems are dealing with their employees in terms of their personal communications on social media, as one example. A lot of confusion about, supplies, whether they're out, whether they're going to be out. There's been personal requests by employees looking for masks, as an example. Is that a good thing? Is it a bad thing? Confusion about what's happening within the organization. And so not only is internal comms so important, that audience so important, but even how you deal with that audience is so important, because no matter what it is that you're trying to do, you always have to remember these people are going above and beyond and are dealing with a terrible situation, no matter what it is. And you've got to be really sensitive to that. No matter what your message is, you've got to be so sensitive to what they're doing.
Right. Yeah, absolutely. And the other thing is, things are changing so fast that we want to keep the public updated, but we want our employees to know first. So even things like visitation guidelines, like they could be really just changed on a dime, And so there's a balance of like, you need to know people who are out there in the public, what they're going to do, what there's expected of them, but we got to inform the employees first. And I think that's one of the challenges I've seen with this. It's just things move really fast. We were even trying to explain to our employees about, when you're coming back from work from traveling, what are the guidelines you should follow?
Right.
Well, CDC is changing the guidelines every 24 hours. So, again, like the speed of what things are moving is really quick, and trying to get out front. And that's how I think I've sequenced things. Like, what are we trying to get out front? Let's let our employees know first. And then we may have to let the public know 20 minutes later, but we've got to give the employees some sort of heads up. And we also have to make time to, like you were saying, what they're going through. We got to acknowledge that this is a really tough time for them.
Yeah, absolutely. And, the other thing I think that we've talked about a little bit last week, and it's something that you brought up, Alan, in our prep for this. Brand is everything right now. And there's a number of ways to think about that. But I mean, what's your take on brand and where things are at, given everything we just talked about?
I think it's just a really important time, because right now it's more people are wanting to consume messages from us than ever before. Like, I think of your books, right? Joe Public doesn't care about your hospital. Well, right now they do, because we're putting out information that they literally need all the time. And that's one of the big differences. Before, when we're putting out messages, we're trying to pull people in. We're like, it's tough. We got to get people to think about what we're offering. Well, now it's sort of like they're grabbing at us. They're like, what do you have? And I just was thinking a couple of days ago, we stood up a hotline for people to call with questions about whether they should get screened and things like that. And immediately it took off like wildfire. We put it out, on social, and it's blowing up all of a sudden. Well, that wouldn't happen at any other time. And so this is really, I think, for a lot of organizations where your brand is going to be in front of a big audience, probably a more aged diverse audience than ever before. You kind of got all eyes on you. And if you do a great job with the experience and everything, I think it's a real benefit. Obviously, this is going to be tough because, you know, if some institutions or whatever are overwhelmed with patients, it's going to be hard to have that experience be good. But I think with your messaging and how you treat people and all that, this is a time where it's going to have ramifications in the future of how people think about you.
Oh, I mean, I don't think that can be, I always get these backwards, overstated. Is that the right way to put it? I don't think that can be overstated. You know, we have, you and I and others, you know, on this podcast and people in our field work a lot and have worked for years about how to build brands, and it takes that kind of effort. But it's situations like this that will shape your brand for a decade to come. And I think even like we don't even know to what degree that's true. It goes from everything from your clinical response to the experience you give, to the messages you're putting out, to the crises that you face every day. All of that's going to shape. And to your point, Alan, I'm not sure even, you know, you in New York, right? The poor hospital and health system folks there are just getting overwhelmed. If you as a hospital are overwhelmed because you're a level 1 trauma center, because you serve a population that just happens to be out in front of this, whatever the case is, that doesn't necessarily mean that your brand is going to suffer because you were overwhelmed. It was hard for you to handle it. Because your people are heroes, and people will see that. They will see the response that you're trying to make. And most folks, I don't think, are blaming hospitals for the shortages. They're not blaming them directly for being overwhelmed. And so, you know, you can probably get through that part of it. It's the other things like how you respond to things and what your messaging is overall and how much of a leadership role you play. It's really too soon to say, but I think it is safe to say that the impact of this could be profound.
Yeah, and I think there's an education piece too, because I was thinking about one thing. So, you know, over the weekend, we had someone reach out on Facebook, and they were concerned because they hadn't got their test results back. They were looking for a loved one who had some test results for COVID-19, and, you know, hey, where are the test results? Well, you know, when we do the testing, it has to go to the county. It has a 24 to 48 hour turnaround time before we get the test results back. Then we have to call you and all that. But they don't understand all that. And then rightfully so. It's like, you know, I went into the hospital, I got tested. Where's my results? Why can't you tell me? And so this is a time where I think in instances like that, we decided, well, we have to be really more aggressive about explaining what are the screening procedures. We need to get something out about that. We need to tell this person, you know, contact them immediately. And we did that, and we kind of resolved that thing. But what's going to be challenging for hospitals, I think, is even if you're not overwhelmed, and we're not in this market, but it's still things like not having enough tests, or the test turnaround time is too long. And people they're not going to make that definition of it's not your fault, it's the county's fault, or it's the federal government's fault, or whatever. They're going to look at you and go, I went to your hospital, where's my information? So that's the thing where I think just keeping the dialogue with people, sharing as much information as we can, being transparent, and then treating them in a kind, compassionate way, that's going to make a big difference.
Yeah, for sure. Just a reminder, if you've got questions, put them in the Q&A queue. And we'll get to them at the end. Another thing you brought up, Alan, that I think is we're always looking for something positive, which is really difficult in all of this. But I agree 100% with a topic you brought up, which is we see this telehealth, I think is the best example, accelerating. Well, I think maybe we said this on the podcast last week. I can't remember. Necessity is the mother of invention. Maybe it's necessity is the mother of adoption, because we're seeing change accelerating in ways that we've always wanted, but because there wasn't necessarily a burning platform and urgency to it other than consumerism and new entrants and things, now it's life or death.
Right. Yeah, totally. And I think, you know, we talked about a little bit as you disappeared into Never Land somewhere on the internet. But yeah, I think it's really making the opportunity to do things we already kind of knew that would be valuable, but it was hard to do because you had to have a business case. You had to have, you know, a real burning platform, or you had to convince people. Well, now it's like those things are not really a barrier anymore, because everyone knows that we need to reach people. I mentioned here, you know, we're in a stay-at-home order for a whole state. People, they can't leave unless they absolutely have to. So why wouldn't we try to have something that can make the connection a little easier for them? And I think there's high-tech things that are great that we're looking into. I even mentioned the old school stuff, setting up a phone line. All of a sudden we got calls, you know, again. So there's so many ways that we can do that. And I also think to your point about sort of embracing the opportunity for a little innovation on the internal communication side too. So, we had ideas of doing things like podcasts and videos and other things that we dabbled with a little bit. Well, now we're like hitting the accelerator going like, we need to get the messages out so frequently. It's not enough just to count on an email, so that it opens up that experimentation of like, let's try everything, see what works. And then we know if it's embraced well, either on, the employee side or on the consumer side, it's going to be something to last and we use when we get past this.
Yeah. Yeah. And it's, the adoption of telehealth or other changes that we want is not just industry. It's also consumer comfort. And that's one of the things that actually stood out to me in the survey that we've got available. We asked people about telehealth and virtual care. And the first question was, have you heard of it? And I was surprised that 42% of the people who responded had not heard of telehealth or virtual care, which is, I guess, astounding to me, but only maybe because, that's like old news to us in the industry. But it's not just, health system adoption of virtual care and telehealth. It's also consumer comfort level with it and use of it. And it's something like this, again, that will accelerate that, where you can imagine coming out on the other side of this, where that number now is like 90% of the people have heard of it. Yeah. And 80% are comfortable using it, right?
Absolutely. And I also think, I'm not that surprised that people didn't really hear about it that much, because in some aspects, a lot of times their relationship was working fine. If they had a doctor, if it could get in, it was okay. And so, why do I need to do this? Or I'm fine with what I have, or there wasn't a lot of, again, maybe motivation even for the physician practices to offer it. So, now you've just got a whole new dynamic where you've got people who they need care delivered virtually because, again, they might not be able to get out of their house for 2 more weeks. I mean, here, our stay-at-home order is still in place till April 7th. That's still 2 more weeks that people aren't supposed to go in about. That's going to be a real game changer, I think.
Yeah, for sure. For sure. All right. So wanted to give you a platform, Alan, because you've shared this on LinkedIn and it gave me a chuckle, but I think it's worth sharing. Why don't you just go ahead and set it up and tell us what you're thinking?
Yeah. So, well, the one thing that I've found, just, I don't know, for lack of a better word, a more graceful word, kind of annoying, is how much outreach is going on, how much bad marketing is going on. So I see this at a lot of levels, but let's just drill down into our profession. So all the people who are still sending me emails about, hey, what's your customer acquisition strategy for 2020? I can barely even contain myself, because, right now we're not trying to acquire new patients. We're trying to direct people to the care they need that's essential and help everyone else navigate, what they need. We're not trying to drive, volume to the service line. Now, a year from now or 6 months from now or whatever, well, then we might need to have that conversation. But to me, what's just annoying and offensive about it is that's bad marketing. You haven't realized what your audience is going through. You haven't tried to tailor your message. You're not offering them anything they need. Those are all just principles of, I think, really bad marketing. And even just looking at large scale marketing on the consumer side, I am surprised how many organizations, big companies, again, maybe they're just thinking about their ad buy that's in place, but they're, when you're trying to sell products that, again, people can't get outside and buy anymore, or is this appropriate, or should you try to do something different? And so I just feel like there's a lot of bad marketing, and I want people to stop that.
Yeah, and it's a very fine line, obviously in our world, but even for other brands who want to show their support, want to show that they're, still relevant in the situation. And sometimes they're doing well, and sometimes it's just like, no, that's wrong. Like, I'm sorry, whatever that is not appropriate. And I think even with health systems, we've mentioned this last week, we have a lot of clients, and we see others in the market who are using the media they've already bought, or their position as the place people turn to for health information that they trust as leaders in the community, to go out there and actually deliver really powerful messages around education or support. But even then, you have to be careful, because if you are, to go back to your you alluded to earlier, if you're a health system that's overrun, if you're a hospital that's overrun, if you're a hospital that's had some kind of bad situation that's in the news right now, if you're dealing with a PR crisis that's above and beyond what we're all dealing with, even with those positive kind of efforts, you've got to be very careful, because you may put out something that makes complete sense in terms of appropriateness and relevance, but if people see that and then they see a news story about how I don't know. Like, I'm not even going to put something out there because I don't want to call attention to anybody. People might connect the two in a bad way. So you've got to be super sensitive to what's going on in your situation, no matter what is the message you're trying to put out with your brand.
Yeah, absolutely. And I think even like I was mentioning, we had some, social and other things planned that were health tips. Totally fine. Those are fine things. But right now, not alluding to the fact that, you're stuck in your house, you can't get out for a walk, maybe you can't do the same healthy cooking because grocery supplies are low. Like sending those things out now would just be, I think, so tone deaf.
Yeah. Yep. That's right. Okay. So we've got time for maybe one question. One of the questions we have is like, what are some of the fundamental differences between internal and external communication when we talk about this crisis? And I think you hit maybe the most important one earlier, Alan, or we both did. Internal has to come first. It just has to come first. We've got to make sure that we are managing. We always talk in this industry about, hey, the number one way to build your brand is through your people. They're your brand ambassadors. So in this case, the flip is true. You've got to make sure that they know that you care about them, that they are heard, that you are communicating anything of import with them first, right?
Yeah, absolutely. And I think this is one of those times where it's almost impossible to over communicate. If you're reaching out once or twice a day to all staff, we started doing that. I just, again, and looking for new ways to reach them. And I think you're right. Like, what is the message? I think that's probably how I've approached the last 2 weeks is every day, like, what are the internal messages we need to get out? Prioritize those, figure out what of those messages we need to get out to the public too. Like I used an example of visitor restrictions we did last week. Obviously we got to dial that in with our staff first, figure out the sources they need, send out the messaging, and then we've got to put out the public messaging. And, I think that's the way to try to do it every time. And occasionally there's a crisis comes up or the news media is knocking on the door and something happens out of that order. I mean, that will happen, but I think most as you can lead with that internal focus and then figure out what you want to push out to the public.
Right. All right. So, Alan, thank you for joining us. Very helpful. Hope to see you out on LinkedIn and wherever else we all are. I'm no longer on Twitter. I stopped Twitter more than a year ago because I just couldn't bear what Twitter has become. And I really wonder, like, what it's like out there now.
Yeah, don't start now. Don't start now.
No.
Too late.
I'm not going back in now. But yeah, so LinkedIn has become my primary business tool for communicating. So I know I see you there a lot. Hope to see a lot of you out there in the podcast at this LinkedIn group. The more we can help each other, the better. Somebody just commented in the Q&A, it's a terrifying place on all social media now more than ever. So unfortunately, I think that's true. I've had people tell me like they're staying off Facebook because they just can't take it. And I've been on Facebook for 2 years for a different reason. So I'm missing all of that. I guess it sounds like it's a good thing.
Yeah, give yourself some time.
Yeah. Well, Alan, again, thank you so much for joining us. We really appreciate it.
You're welcome. I'm glad I could do it.
Everybody, well, thank you, Chase. I got to thank you as always for carrying the boat while my
absolutely.
I will not call out my internet provider this time.
Yes.
But I can tell you over the weekend that happened twice. So I'm sure they're suffering like everybody else with capacity, right?
That's right. Yeah. And I had actually stated incorrectly where the webinar is going to be hosted. It's going to be hosted by Strategic Healthcare Marketing Webinar. So feel free to use the URL in the chat. That's who's going to be hosting the webinar. And
that's tomorrow for folks.
Yeah. Yes.
Yeah. Okay.
Yep.
Tomorrow we're going to have Jeff Spear, who's an EVP at ReviveHealth, join us. He's going to delve deeper into that consumer survey. We are considering repeating the survey this week and maybe on an ongoing basis. We're trying to figure out whether we have the capacity to do that because this is, as Alan has said multiple times, this is just changing so fast. And seeing how some of the feedback we're getting from consumers will change is really important for all of us. So we're looking into that. Remember to visit thinkrevivehealth.com/COVID-19 for a recording of today's episode and all of our content related to this crisis. Please remember to let other people know about this podcast. And again, to everybody out there, healthcare marketers, communicators, what you're doing is so important. to organizations. It's so important to those people on the front line. And it's so important to us as a country getting through this. Accurate, prompt communication is more than half the battle here. So please hang in there, and we will be back tomorrow and every day until this crisis passes. So thanks for joining, and we will talk to you tomorrow.